it's like 6:02. I think there'll be more people that come, but we'll go ahead and get started. So I'm Emily. I'm the program manager here, also one of the dietitians. We are super, super excited because Dr. Scott's here with us. She did this for us last year, and it was awesome. And so this is a little bit different. She is our plastic surgeon here, so we no longer have to refer out, which is really, really awesome. So we have a nice little pathway to work into Dr. Scott, and she's super awesome, so we're glad to have her. So whether you're pre-surgery, post-surgery, this isn't right now, whatever, like we still have that pathway set up, we have all that communication, so whenever you're ready, if you're ready at some point, we will do that for you. So I'm going to turn it over to you.
Great. Thank you guys for coming. So like Emily said, my name is Keandra Scott, and I joined Lexington Surgery Group about 1.5 years ago. So today I'm just going to talk about paniculectomies and what that is. Does anyone know what that is or heard the term or anything? Do you want to say? No? Okay, that's fine.
I work in healthcare. So.
Okay, yeah, sure.
Is it a tummy tuck?
It is not a tummy tuck, but, and we will talk about that. So a paniculectomy essentially is a body contouring procedure where we remove something called the pannus, which is that lower belly kind of fat tissue that all of us hate, right? But specifically a pannus is when it hangs lower than your kind of private area. And we'll talk about all of that. So yes, that's what a paniculectomy is. It's similar to a tummy tuck, but it's not a tummy tuck. And the reason why it's not a tummy tuck is when we do a tummy tuck, we're tightening your abdominal muscles, right? And we're doing some liposuction. That's a cosmetic procedure. A paniculectomy, usually we try to get insurance to cover it because it's a functional procedure. Usually patients complain of rashes, lower back pain, that sort of thing. So close, but not quite. And also I want to emphasize this is not a substitute for weight loss or an exercise program or bariatric surgery, okay? So once you've lost your weight, however you choose to do that, and you have that stubborn skin and fat that won't go away, then a paniculectomy might be an option for you.
Is that something where they cut you completely all the way around, or?
No, so, and I talked about that last year, all the body contouring procedures. That's called a circumferential body lift that you're talking about. So she asked if that's where we cut you all the way around, front and back. No, this is just addressing the front.
Irritating spot.
Yes. So what makes you a good candidate? So a good candidate is someone who's physically healthy. So that means if you have any medical issues, that those issues are stable. For example, if you have diabetes, that your hemoglobin A1C is below 7. If you have any heart issues, typically, unless you're really healthy, you're not having any chest pain, I try not to do any elective procedures if you have active chest pain or had a recent heart attack, if you will. So if you're physically healthy, that's number one. And the reason why that's a criteria, really for any surgery, is that we want to make sure it's safe for you to undergo general anesthesia. Another qualification is that your weight is stable and that weight is less than, or your BMI is less than 35. So if you're in the program, you might know what a BMI is, but if you don't, it's your body mass index, which is a calculation of your height and your weight, and it gives you a number. And typically, if you're less than 25, right, that's normal, which most people are not normal. But if you're less than 30, that's when you're not in the obesity range. That's just overweight. But for me to be able to do the surgery, realistically, most patients who are going on to have bariatric surgery, you're not going to be, likely not going to be a BMI of 25. So 35 is my threshold. But that may change once you see me if you have significant fat around your belly that still may need to be lost prior to having a paniculectomy. Okay, so that's just one kind of threshold that we use to get you guys to come see me. But once you see me, I may say, hey, you're not going to like your result. I recommend you lose a little bit more weight, even if your BMI is less than 35. Does that make sense? And really, I just want you to have the best result, look good, that sort of thing. The other big thing is to not smoke or use any nicotine products. Usually it's a bigger deal for plastic surgery versus a lot of other surgeries, just because we're dealing with a lot of wounds, and the whole point of this is for you guys to heal well and look good. And cigarette smoking or nicotine can cause wound healing issues, infections, and then you're left with worse scars, and so we don't really want that to happen to you. Another thing is if you're bothered by the appearance of your abdomen. Now that's not a requirement for insurance to cover it, but I take that into consideration because it matters. And then for insurance purposes, if you have recurring or persistent rashes or infections that are underneath that penis, where you're having to take medications, apply creams, powders, that sort of thing. And I bolded infections because insurance is kind of cracking down on it not just being a rash, but you having to need antibiotics for the infection to go away. So we've been trying to fight that with our new pathway, which we kind of talked about. So once you come and see me, so let me back up. So after your weight's been stable for 18 months, 12 to 18 months, you'll see Lori Norris, who's our nurse practitioner in bariatrics. You'll see her for a number of months. She will give you all of your medications, all of your antibiotics, really just kind of get you to the point where insurance is gonna say yes to you having this surgery. And then you'll see me, then we'll have a consultation. And in that consultation, we'll go over all of your medical records, all that good stuff. And then I'll look at your abdomen, make sure you don't have any scars that may impede what I'm gonna do. I'll take pictures, I'll send that to the insurance company. If you have a rash, I'll make sure to document that. The photos that we take don't go online, or I don't post on Instagram or anything like that, but I do have you sign a permission slip saying that you give permission for me to take photos. And then if I feel a hernia or something like that, I'll get a CT scan just to make sure you don't have a hernia. And if you do, I'll consult Dr. Antonetti or one of the other bariatric guys to help fix your hernia during that same surgery. So we'll do a combination surgery with the skin removal and then fixing your surgery. Any questions so far? Yeah.
If you've had cesarean sections, is that something that might make you not a candidate?
Nope. So the C-section scar that's right underneath the penis.
It goes this way.
What's that?
It's up and down, not side to
For
side.
you?
Yeah.
Yeah, up and down is fine, side to side is fine. Really, the scar that we typically don't like is if you had your gallbladder removed on the right side and you had like a big open like gallbladder removal, which most people haven't had that nowadays. So the scars don't really matter that much.
Why don't you like that?
Well, so I'm just gonna talk shop. So whenever we remove the skin here, right, I kind of have to raise up that tissue, and that's gonna knock off the blood supply in the middle of the belly. The rest of that tissue that I'm gonna pull down is gonna come from the sides. So if you've had that big long right kind of upper quadrant scar from an old time gallbladder removal, then that's gonna basically cause that skin to die. So we don't wanna do that.
So that would just automatically rule out that
Yeah.
person as a candidate.
Yeah. C-section scars fine, vertical laparotomy scars are fine. Sorry, talk about that. So the other thing, like I said, if I saw you, your BMI is let's say 31, but you kind of look like this guy, I'm gonna tell you, you have to lose more weight, right? Because that fat, I can't remove that fat. That fat's called visceral fat. Visceral means organ. That fat's around your organs. It's not something that I'm gonna be able to liposuction or remove because it's inside your body. And the only way to get rid of that is dieting and exercising, or bariatric surgery, or whatever method you use to lose weight. So if you come to me and you kind of have that basketball looking belly, removing the skin down here is not going to really do much for you, okay? So not like being mean or anything. It's just you still have some weight to lose. And some people hold weight in their belly more than other places. So that's why. Does that make sense?
Yes.
So the risk for surgery. Most of the time the risks are very minimal. If you do have a complication after this surgery, the most common thing is you can have your wounds that may not heal in certain spots, but usually they heal on their own. That's called delayed wound healing. And really it's because your skin's loose, your skin's lost, it's kind of elasticity from you losing weight. But other than that, you know, if you're healthy and you know you're a good candidate for surgery, it'll heal fine. Anesthesia risk, anesthesia will go over that with you guys once you have surgery, but those are pretty minimal. You may have some asymmetries, right? This is not, you know, I'm not a robot, but we try to make things look good. If you do have some asymmetry or something that you don't like afterwards, in a few months, we can always bring you back and do a minor revision. Bleeding is another one. Every surgeon's gonna say, anytime we operate on you, bleeding is a risk. DVT or deep vein thrombosis. So anytime you undergo a long surgery or your BMI is over 30, your risk of having a blood clot, which that's what that means, deep vein thrombosis, a blood clot in your legs is a little bit higher. And so if your risk is high on that end, I kind of calculate that with a specific score. I will give you something during surgery to help thin your blood to prevent you from getting a blood clot. Fat necrosis, that just means that some of the fat may not survive, if you will, but usually it just kind of feels like a kind of hardened, scarred area. And if that happens, we can always remove it once you're healed several months down the road. But that is not a big deal. Fluid accumulation or seroma. So you can imagine we're removing all this tissue, pulling everything down. We're creating a big space in the belly. Usually I use a drain tube to help drain that fluid that your body's gonna put there. Once we remove that tube, because we can't leave it forever, that fluid can still accumulate. And if that happens, I just remove it in the office. And if it's a really big deal, then I'll take you back to surgery to remove it. But typically it's an outpatient procedure. Doesn't happen that often, but if it does, it's a pretty simple fix. Infection risk, again, anytime we cut the skin, there's a risk for infection. Any surgeon's gonna give you antibiotics before surgery. I give you antibiotics after to help prevent that. You may have numbness or skin changes in your abdomen. Anytime we're cutting skin and moving and pulling things, it stretches little tiny nerves, but the feeling does come back. You may have persistent pain as a scar, depending on how you heal. I haven't really had anyone complain about that after this procedure though. Like we talked about, delayed wound healing, possibly needing a revision, recurrent looseness of skin. So I kind of always mention that in the consult because let's say you were 500 pounds, you lost, 300 pounds. You're gonna have a lot of skin. I can pull as much as I can, but over time, you may still have a little loose skin. Not hanging skin, but your skin may not be taut, like mine, I guess, if you will. But if that happens, I just resubmit to insurance and we just tighten things up if we need to do that, okay? Skin discoloration, that really doesn't really happen. Your scar may be a different color than your normal skin, and that's fine, it's a scar. You will always have a scar after this procedure, okay? And then suboptimal anesthetic result, again, if you need a revision, you would just do that, okay?
What would be some of the reasons you would need a revision after that surgery?
I'll show you pictures, but let's say you had some extra skin near your scar or some little pockets of fat that you might want removed. Your scar is kind of crooked, that sort of thing.
Does insurance cover that too?
Yep. If they cover the first part, they'll cover any revisions afterwards. Any other questions about that? So surgery. preparing for any surgery, I get labs, complete blood tests. Make sure you're, taking all of your vitamins if you've had a gastric bypass that you need to take. If you do smoke, I don't just simply say no and, kick you out the door, but I do tell you stop smoking 8 weeks prior and 8 weeks after. And most people just stop smoking completely, since that's 4 months basically of not smoking. I'll tell you what medications to stop and how long to stop before surgery, and then make sure to bring someone with you. Typically this is outpatient unless you have some medical issue where I want to keep you overnight, then I'll keep you overnight for the surgery. So the first step, anesthesia. Usually it's general anesthesia. Surgery time is about 2 hours. Really it's just because there's a lot of skin to remove and close. It's not that the procedure itself takes that long, but it's only me, so I have to sew usually long incisions. So how we do the surgery, again, it's similar to a C-section scar, but it's pretty long from hip to hip, just because I want to remove all the skin. And then your belly button. A lot of patients ask, well, do you remove my belly button? I do not remove the belly button. It stays attached to your belly. The only thing I do is when I pull the skin down, we make a new hole, pull the belly button up, and suture it. Okay? So we don't take it off and put it back on or anything. Yeah, so I just talked about all that. So this lady, again, she had a very large penis here. Oh no, my little circle's moved. This circle was supposed to be covering her mons, but anyway, and that was her belly button. But anyway, as you can see, we've removed this penis, pulled this down, made a new hole for a belly button, and this is her kind of bending over, and she's pretty flat there. The other thing I want to point out, so she came back to me after her surgery and said, Dr. Scott, like, did you add fat in my thighs? And I was like, no, I didn't. So you can see here, she had this kind of weird pocket of fat there, but she couldn't see it because of her belly. So a lot of times I'll do breast reductions, I'll do all sorts of things on people, and I try to tell them, you're gonna notice things that you may not have noticed before, okay? So we're talking about doing a thigh lift for her, but that's what that is, okay? Nothing to do with surgery. This is another lady. She, can't remember how much weight she lost, but very, very loose skin here. Insurance surprisingly paid for hers, even though her penis doesn't hang as low as they typically want. And then this is her, she's pretty flat. That's a belly button that we brought back through.
I have a question. You said as low as they typically want it, so they want it lower than that?
The skin hanging?
Yeah.
Typically, yes. But I mean, if you came to me and you complained of rashes and back pain, I'll submit it. I submit the pictures to them. And whether they decide to approve it or deny it, that's them. But for her, I submit it.
If I felt like there was rashes now, would it be smart to tell Lori or whoever?
Yeah, I would. Take pictures, document. Yep.
Okay.
And she takes pictures in the photo room in my pod too, so I would let her know if you guys are wanting to have this done, to go ahead and start documenting it.
I just wanted to add,
Yeah.
currently I'm going through the process.
Okay, thanks.
And so yes, there's like two antibiotics and a cream and like an anti-yeast
Yes,
medicine
yep.
that they have to prescribe. So they have to go through the processes in order for the insurance to cover it.
Yeah.
And I'm on like the fourth. So
Fourth
hopefully
round,
hopefully
yeah.
I'll be seeing you soon.
Well, good. Yeah, it's a pain, but obviously I think this is an important surgery, but the insurance companies are gonna try to find ways to wiggle out of it, but
So, I'm sorry.
yeah.
So, I don't know who it was that was asking the question, but so whoever it was that said that, as soon as you your next appointment or whatever, if you've got a rash or anything like that, bring it to Lori's attention.
Yeah.
Because that's what I did. I actually didn't think that insurance would even touch it. And Lori told me that it would, and they just have to go through the process.
I have a question.
Mhm.
What if you get like not having to do with this area, but
Mhm.
between your legs?
Yeah.
You constantly get rashes between your legs because your thighs are constantly.
Unfortunately, most insurance companies, actually, I haven't had one cover. I mean, TRICARE, I don't know, they cover everything. But most of the time, they're going to consider it cosmetic. Yeah. Any thighs or arms, they're going to consider it cosmetic.
How much does a general thigh lift cost? Just
I don't know. I typically don't talk prices. Yeah, because it depends on where you go. I mean, I would say if I had to guess, and I don't memorize the numbers for this very reason, but I don't know. I'd say maybe 8 to 12,000 out of pocket. Yeah. I think. Could be maybe
you have to pay out of pocket for this. It's expensive too.
I mean, that's relative, right? Expensive. You know, you're going to pay some thousands, but we will send you a quote. So if insurance denied you, we try to appeal it. And then if not, and you're wanting to pay out of pocket, then we'll send you a quote with all the fees and all that. But it's not that much. This is another lady. So, yeah. Mhm.
Earlier you said this isn't a tummy tuck, but if you have this surgery and later you decide you want a tummy tuck, can you get a tummy tuck after this surgery, or is that?
Yeah, you can. It would just be like a revision tummy tuck because the skin's already gone. But if you're wanting to have the muscle repaired and lipo, I'll go over all of that with you in the
Oh,
clinic.
so you can do that at the same time?
Yes.
Oh,
Yeah.
okay, okay.
And I'll just send you like a separate quote for anything that's additional.
The insurance might not cover it.
Correct.
Okay.
Yep.
Very good.
Yep.
I'm sorry, I have a herniated mesh implant, so
Mhm.
would that, like, kind of prevent you from
Nope.
doing that?
No, usually the mesh is near your bowels. I'm just removing skin and fat. I'm not going inside the belly, not doing any of that.
Okay.
Unless, you know, your mesh is like attached to your skin and you've got like a fistula or draining wound or something like that, but typically no.
Okay, and that's with the tummy tuck as well? You can do it either way?
Yep.
Okay.
Any other questions? Yeah.
Would it be typical to get, penicular, tummy tuck, and a breast reduction at once?
So it depends if and I'll show you later. I did both on. If you're small and like I feel like it's gonna take me less than 6 hours, I do them at the same time. But nowadays I just separate them. Yeah. So this lady, she was not a weight loss patient. She came to me. She met the BMI requirement. I told her, you know, you have visceral obesity. Basically, she still has this kind of. All of this was not fat that you can pinch. Anything that you can pinch, I can remove. So then we did her peniculectomy, and from the side here, you can see that she still kind of has like a round look to her belly, but she was very happy. We got rid of the pannus down here. Insurance paid for it. So, you know, you don't have to be a weight loss patient to have this surgery done. Okay. This lady, she's a little bit older, lost a lot of weight, had a lot of loose skin. Peniculectomy. She's very happy, no more rashes. And most of these patients are only like 2 to 3 months out. So the scar is gonna fade, it's gonna heal. Yeah. I have one more. So this lady, I did a breast lift on her, reduction and a peniculectomy. I also already revised her, but she has this kind of extra skin here that kind of, this little pooch here. So that could be a reason for a revision. Yeah. So we just, you know, straightened out her scar and got rid of that. And she looks great. Breast lift.
Looks a lot better.
Yeah. Any questions about surgery results or anything like that? Yep.
Is it just your rule that you won't do surgery on somebody who's had gallbladder surgery? Or is that across the board with everybody?
It's not the gallbladder surgery. It's if you had a specific.
From here to here.
Oh yeah. Most people will say no. I wouldn't take that chance, but if you saw me, I would just refer you to someone else and get a second opinion.
So it's just you, it's not like insurance or other?
No, it has nothing to do with insurance. It has to do with anatomy and complications with surgery. Yeah.
What was the question?
She was asking about the gallbladder scar that I talked about earlier. If it was just unique to me that I would say I would recommend not having surgery, or if that's a global thing.
That's only with the old gallbladder.
Old gallbladder scar. Yeah. Has nothing to do with the gallbladder, just the scar.
Yeah.
That was done. And usually most people are having it done minimally invasive, laparoscopically with tiny little portholes. Those are fine. So recovery. So typically any swelling or anything like that will go away in 4 to 6 weeks. You know, you'll notice results if you have a true painus. You'll notice results right away. After your surgery, we'll tell you how to take care of your incisions, all the fancy stuff. I'll give you a compression garment. I want you to wear that for 2 months after surgery. It helps with swelling. It helps keep things tight. It helps remind you that you had surgery. And then no exercising or chores or anything that's gonna work you up, raise your blood pressure, and not going back to work for at least 4 weeks if you do something strenuous.
Oh.
Yep.
I was just gonna ask you,
Yeah.
so if that's only if you do something strenuous,
Yeah.
so if you have a sedentary job,
Yep.
you could go back sooner.
Usually, I say 2 weeks, right? Because your drains are going to stand for 2 weeks. You probably don't want to go to work with
No.
drains. And then after that, if I feel like you're going to be compliant, we'll discuss going back earlier. So yeah. Yep.
You do this surgery.
hmm
Does it change the anatomy of the woman's?
Like your mom's pooch.
Yes.
Yeah. So sometimes let me go back. Well, you can't really tell. But yeah, so this part's gonna, I try to put the incision very low so that it pulls up and you're not left with like a pooch there.
Yeah.
Same thing here with this lady. She had a really big
Yeah.
pooch. Hers is pretty much flat. So yeah, no. Try not to do that. Obviously, if you have any complication, call the office. Usually most things can be handled by just calling us. We'll see you the next day or the same day. But if you're like, I'm having chest pain, I feel faint, just go to the ER. Okay. Other than that, that's all I have. Any questions about anything?
I know you're saying this, that, the insurance may cover it. Will they also, depending on what it is, will they cover like a breast reduction or?
Yeah, if you're having back pain, if you're having rashes under the breast, neck pain, and you have large breasts, then yes. Typically though, after you've lost a lot of weight, sometimes you lose it in your breasts, and so it's hanging. So I've gotten them to pay for breast lift, which is really not a reduction, meaning you just want it lifted, all the loose skin gone. And I think they'll pay for it 50-50, yeah, if I had to guess.
What's is the BMI the same for a breast reduction?
Yeah, the BMI qualification is 35. And most people around town, I'll say 30. You go to private practice, their BMI cutoff is 30. I don't know what Prisma's is, but 35 is usually the magic number.
Will you do the breast lift and the penniculectomy at the same time?
I was just telling her if I felt like I could do it in under 6 hours, then I'll do it.
I know you said you don't really talk price, but if for some reason the insurance company didn't pay for the penniculectomy, what's the average?
I don't do that. I don't.
No.
Yeah, it's between 6,000 and 7,000.
Yeah.
Oh, that's less than I thought. Okay.
Yeah.
Good to know. All right.
And if you have a question, I'm sure you just call the office. Tammy, my scheduler, she can just give you a quote.
Okay.
Yeah.
And that's including the anesthesia and everything?
Mm-hmm.
That's everything.
Are you
Yeah.
serious?
They do it at Irmo and the outpatient centers.
Yeah.
Okay, well, that makes me feel better. Just in case. I'm hoping that the
Yeah,
insurance
there
will
you go.
cover it. Just, yeah.
A tummy tuck is more, right? Because we're doing more.
Okay.
And you know, a paniculectomy is just that. It's just removing skin. It's not like giving you a nice like curvy shape or anything like that, unless you already have that underlying all the loose skin, which a tummy tuck does that, right? So if you go online and you're looking up paniculectomy, it's not going to look like a tummy tuck. Yeah. Correct. So just be mindful of that.
What operation is it where they remove your belly button? Is that like a complete tummy tuck or?
It's the same thing. A tummy tuck is the same thing, except we're tightening the muscle, doing lipo. So we're not removing the belly button. I mean, there's a procedure where you could like cut the belly button but still attach and just pull everything down. But that's usually reserved for like people that we're not removing a whole lot of skin. Yeah. It's a tummy tuck. It's a version of a tummy tuck. I think, did you have your hand up? Or?
Yeah, I was gonna ask, have you had patients where, like a bariatric patient, where they may not need a paniculectomy and the tummy tuck will be better?
Yeah. So where you don't have a lot of skin hanging, don't have a lot of loose skin, but you got like a little pooch. Yeah. Or some people say, I don't want a paniculectomy, I want a tummy tuck. Then we'll do that if they're a candidate.
Is this something that you have to have, or is this can you lose some of that excess skin fat on your own?
That's a good question. So, whenever you lose weight very quickly, your skin, you're gonna have more loose skin. If you lost weight with exercise and dieting, which Emily's like, oh, your skin has more chance to tone up. But that's usually if you're like younger and your skin's not already loose, right? So like a younger person, their skin's more likely to contract. But if you're like very overweight and you're losing a lot of weight, even if you're in the gym exercising, you're still gonna have loose skin. So it just depends on how much weight you're losing, how quickly you're losing the weight. I know like, what's it, Ozempic? People are like saying, oh, you know, they're getting Ozempic butt because it's causing their butt to be like flat because it's targeting, I guess, I don't know, it's targeting butt fat. I don't know. But, you know, if you don't want that, don't use Ozempic. But yeah, to answer your question, you don't have to have a paniculectomy. So all of this, anything that I do is going to be elective, meaning you don't have to have it done. I don't have to do it. So if I don't think you're a good candidate, then, you know, I'll say I'll send you to someone else, get a second opinion. But I'm pretty honest. I care about people's safety and health and all that good stuff. I know you want the skin gone, but if you're not a good candidate, then you're just, you know, you're not a good candidate. So yeah.
Any other questions?
I have a question. After a major weight loss, does somebody's weight have to be stable for a certain number of months before they can have the paniculectomy?
Yeah, so Medicare, Medicaid, it's 18 months after a gastric bypass surgery. Has to be
Okay.
stable for 18 months.
What about the gastric
Or-
sleeve?
You have to be out
Sorry,
18
you
months.
have to be at 18 months, sorry,
Oh,
to have
wow.
the surgery done. Stable weight for 6 months to a year.
Okay.
Yeah.
Okay. Thank you.
So I've said that's the same with the gastric sleeve as the gastric bypass?
I actually don't know. I think it,
I've never seen it any separate. I've never seen it like
Yeah.
separately. It says bariatric surgery.
Okay.
yeah,
Most of the guidelines will say that.
yeah.
Or after major weight loss. Some of them will say like major weight loss.
yeah.
Because it's
Well,
not always like
I've
surgery.
seen the sleeve be cut down to 12 months. So I don't know if that was like Blue Cross or.
So this is where it gets really interesting when you start
Yeah.
climbing into like policies, which you can see
Yeah.
online. So you can like Google these things online too. That's actually what we do a lot of the times. Is you?
Yeah.
It's the same thing we do for bariatric surgery, right? So we check your benefits before you come in. Very much the same thing in plastics. Is kind of checking that policy. At least it's a little bit more similar, I would say, in plastics. It's a little bit more generalized than it is in bariatrics because it could be somebody has no weight management or they have 3 months or 6 months. I mean, there's different things, but a lot of times if they're going to have a paniculectomy policy, it's going to be you need to be 12 to 18 months out of surgery, weight stable, 3 to 6 months, sometimes 6 months to a year. I mean, so yeah. Those are all pretty
When you say weight stable, is there
That's
an amount? Like, is there like you can't gain over a certain?
they don't specify,
They
but
don't.
they have denied someone
Yeah.
for fluctuating, and I don't think it was very much.
Because
Lori's
women fluctuate.
Yeah.
So Lori's pretty strict about her pathway of being 10 pounds, just because she doesn't want you to go through it and then be referred to Dr. Scott and then be denied because your weight fluctuated 30 pounds, right?
Gotcha.
But
Yeah,
she
that's what I
also
was
wants
kinda
you.
looking
She also
for.
wants you to be at the point where like, hey, this is a good place for you. If you and Dr. Scott decide you're going to drop a few more pounds, something like that,
Okay.
not a huge issue. We haven't seen that be a big red flag for anybody, but she'll typically kind of prep you in the beginning, like let's stay within about 10 pounds and make sure
Lori
that
has said that.
that you're at that
That they don't
place where
worry
you're
about 10
ready.
pounds
Yeah.
or so.
Yeah.
Yeah.
Okay.
Like once you're ready to actually start the workout process, she's going to encourage you to stay within that 10 pounds.
Okay.
But if you Google it, it's not going to say in your policy.
No, it's super it's the same
It's-
thing.
yeah.
It is the same thing with bariatrics though, because you can be turned down if you gain weight in bariatrics, but some people could gain 20 pounds in weight management and not be turned down.
Yeah.
So it's when it goes to the insurance company, it's whoever's reviewing it, what they decide at that moment.
Yeah.
Okay.
Am I right to say, like, though, like when we see patients and they say, well, I want to lose another 30 pounds, but I want to see Dr. Scott, you would say, go lose the 30 pounds.
Yes.
And then come see me.
Right, because if we
Right.
do this and then you lose more weight,
Right.
you're just predisposing yourself to more loose skin. So usually just, have your kids, if you're gonna have kids, lose all the weight you're gonna lose, that sort of thing before you have any plastic surgery done.
And I'm sure you lose a couple pounds when you take all that off.
That is a good statement. So yeah, you're gonna lose a couple of pounds. The most I've taken off Panis was 13 pounds, but that's a lot, and that's rare. Usually it's about 5 pounds, if that, depending on how much fat it is, if that. So I wouldn't count on that for losing
Yeah.
any additional weight.
Do you have patients that have children after having children?
I haven't specifically had any patients, but it happens. It's not a big deal. It happens. Yeah,
Yeah, as far as I know you talked about like diabetes or rashes or back pain.
Mhm.
Are there any situations where if you didn't, the rashes were treated with medications
Mhm.
and it seemed to handle it, but you still have a lot of back pain? And you've seen situations where insurance may just say, well, no.
If you're asking if you have a Panis and you've had a paniculectomy and you still have back pain, or you
No.
don't have a rash but you have
don't
back
have
pain?
A rash, but you have a back pain. Like,
Their main thing is the rash, the infection.
so you can have
Infection.
all the pain in the world and never like too bad, so say.
Because most of the time if you're having back pain, unless it's like a very large Panis, it's likely not from the Panis. Yeah. Anything else? I do males. I didn't put any up here. I have had a few males come in and have
Yeah.
paniculectomies.
We just did one like 2 weeks ago.
Yeah. That's
Is it
it for
different
me.
for them compared to females?
Not really. No, I mean, I obviously try not to make them look feminine.
Yeah.
But no, not really. And most men typically don't have as much loose skin as a woman would.
So this isn't the only surgery you do. You're basically plastic surgery will cover lots of
Yes,
stuff.
I do all sorts of things. this tonight was just to talk about skin removal from the belly, and if you had any other concerns, we would talk about that at the visit.
Is this one of the rare surgeries that insurance will cover?
Most of the time, yeah. I mean, well, it depends. If we're talking about reconstructive, right? Because this is considered a functional reconstructive surgery.
Mm-hmm.
Most of the time, insurance will cover that. Anything that's cosmetic, anything that's not medically necessary, like an arm lift, a thigh, facelift, they're not going to cover it. You can lose 1,000 pounds, they're not going to cover it. Yeah. Lots of questions.
I'll chat with you guys about the pathway too, but one thing I wanted to say too is, so if you were referred based on Lori's pathway to see Dr. Scott for a paniculectomy, and you wanted to talk about other cosmetic things, like you would do that at that consult. So it's not that you have to have like separate things. She's going to cover all that stuff. And if we have a couple patients that when they come in, they'll express some interest and they'll say, hey, I don't have a panis. I don't really think I qualify for a paniculectomy workup. Then you would be a cosmetic workup. So you would just see Dr. Scott from that point, and you pay, it's $100 right now, right?
Yeah.
$100 cosmetic fee to see her. That's her consult fee. And then if you decide to go through with surgery, that $100 goes toward your surgery. If not, then you paid $100 to see Dr. Scott. But so that's how that would work.
Can I ask where you got your training from?
I went to the Medical University of South Carolina. I trained there, and I went to med school there.
So you stayed home.
I
At least in
did.
the state.
I did. Yep. I'm from Charleston. And, went to Clemson. So,
We
yeah.
won't hold that against you.
Oh, okay. Good. Gamecock Town.
Not 100%.
Well, if you guys do need anything, have any questions, Emily has my contact. I have cards we pass out. My office is happy to answer any questions that you guys have.
Yeah, and the good news is she's here, so
Yep.
we always have a way for you to talk to her. Easy contact. Thank you so much.
Thank you, guys.
I'll walk you all through this little sheet that I made. I made this today. Okay, so I'll just work you through this a little bit because there's always questions, and I feel like we have a little better pathway now than we did before when we didn't know a whole lot. So basically, you expressed interest in a paniculectomy. So some of y'all talked about like just stating that to Lori or one of our providers. That's super important first step. Even if you're not to the place where you're ready, you're not 18 months out yet, whatever. I mean, just mentioning it, having it in your notes is always super helpful. But basically, what you do is you'd let us know, and then somebody from our staff will check your benefits. So they'll look and see like, does your plan cover a paniculectomy? Because that's also something we don't want to do is work you through a process and then find out you don't have a benefit, right? That's not 100% perfect. We try to do our best at that, but we'll do that first. And then we'll basically set you up with an appointment with Lori. Lori's going to assess at your first appointment, like, does she think you'd be an insurance candidate or does she think you wouldn't? The PANIS, like Dr. Scott said, is one of the most important things. So that's usually the kind of beginning point of all of that. And then does this person have a rash? Right? Those are the two big things that insurance companies are looking for. So if she feels like, yes, you're an appropriate candidate at that point, she'll go ahead and start working you up. That workup process, typically 4 to 5 visits. Because that's documenting everything that basically Dr. Scott is then going to document on and send to the insurance company, right? The more we have to support the case, the better off you are long term, okay? There's no guarantee in that, just like bariatric surgery. Once you see Dr. Scott, you'll go through everything that you're going to go through with Dr. Scott and decide on the plan, and then we would send this authorization to your insurance company, and we would not schedule you until we had the authorization. Again, same way as bariatrics. If you're approved, they'll call you, they'll get you scheduled. If you're not approved, they will send you a self-pay procedure fee and let you know, do you want to move forward with this? Do you not want to? How's that look? Okay. Now, if you're like, if our office checks your benefits, says, you know what, you don't have coverage for a paniculectomy, or Lori decides, hey, I don't know this workup would really be that beneficial for you, I would just direct refer you over to Dr. Scott. At that point, you pay that $100 consult fee, and you see Dr. Scott, and then decide if you'd like to move forward from there. At that appointment, you would get the cost of surgery as well if you're moving forward, depending upon what you guys talk about. Does that sound okay? It's on this sheet right here, this real fancy sheet that I made. And then the paniculectomy requirements are listed underneath there as well. So, and I always hate that sometimes people get upset with these requirements, but it's literally because she is a plastic surgeon and she really wants you to be happy with her work, right? And so it is an elective surgery, and so that's one thing that she stands her ground on, and I always give her super props for that, because she always wants the best for the patient, and she always wants like the best outcome, right? You don't want to have surgery and then say, well, I don't even like it. I don't like what that looks like, right? So I think it's super important to know where that comes from too. As far as what she requires, so she'll say like wait stable for 3 to 6 months. Typically, there's a little bit more leniency there, and if you're at 12 months and you've been weight stable, like she will see you for a consult. Usually, insurance companies will say 12 to 18. That's kind of why we go more toward the 18.
So, just a technical question.
Sure.
So, let's say you start having rashes and things like that. Do we call here?
Yeah.
And say we have them, or do you go to your family doctor?
No. Call us. Yeah,
Okay.
Call us and say you'd like to get in with Lori to discuss paniculectomy or discuss skin rash, whatever you need. Just tell them you want an appointment with Lori.
Okay.
Yeah, Lori owns that side of bariatrics, so she can always work that pathway for you. So just if you call our call center, you just call in and kind of say, I want a follow-up appointment with Lori.
Yeah, because you may start having rashes before you ever get to the 18 months.
Sure.
I guess I'm just trying to say if we need to document a history of. Does it matter if you see your family doctor and you've got the documentation, or you have to be seen here?
I wouldn't say not necessarily. The only thing is insurance companies look for like specific things sometimes. So some are really, really hard. Blue Cross Blue Shield Federal is very hard, right? They require that you have 2 antibiotics, a cream, several things you have to have, right? Blue Cross Blue Shield, Cigna, I don't know, any of the, like some of them aren't that hard. They're not that specific. So you could say, hey, I saw the dermatologist, or hey, I saw my PCP and I have this documentation. So that's where it becomes really wishy-washy. So you're not required to see Lori. It's just that typically we're going to actually check the policy and say, hey, here's what we need. Does the patient meet these qualifications? And if they do, we're going to document them. One thing we're not going to do is falsely document things. So we will not do that. And Lori will be very honest with you. If she doesn't feel like you actually have things in the policy, she will tell you that.
So is the 45 over 45 months, like the way they do?
Yeah, it's typically over that time frame, because you have to prove that, okay, that might have helped, but that did not take this away.
Does that have to be after you reach 12 months?
After what?
After you reach the 12 or 18 months?
It would have to be after 12. The insurance requirements typically would say 12 to 18, but if you started the process, if you were weight stable at 12 months and you start the paniculectomy process, by the time you got to Dr. Scott and had surgery, you'd be closer to the 18-month mark. Does somebody else have a question?
I just wanted to clarify the visits with Lori. If somebody's in their first year or second year and they already have bariatric follow-up scheduled every 2 to 3 months, can they ask Lori to address the symptoms, even if it's only been 6 or 8 months? since
Absolutely,
bariatric?
yeah. Because the more, that's why you should bring it up, because the more you have in your file, the better off you
That's
are.
actually when I brought the very first time I brought it up was during one of my follow-up visits.
Because then the insurance company can see this long history, even before you met your weight goal. They see this long history of, skin irritation and painless and all those things. So.
It also gives you more opportunities every time you come in for documentation.
Right, so it won't get you to the paniculectomy faster, but it will make the documentation
Stronger, yeah. Make the case stronger.
And once you've jumped through all the hoops as far as being prescribed all these things, they're going to want to take pictures.
Mhm.
So if you've already been prescribed all these things and you're still coming in for visits, and you can say, I've got something going on, and they can take a picture of it.
Yes, perfect. Does anybody else have any other questions? Anything unrelated to this? Anybody have anything? Is this anybody's first support group? Somebody told me that was the first support group. Awesome. Okay. So, oh, cool. So we don't always have a guest speaker, okay? We will typically open this up and let everybody chat and just have different topics every month that we come in. But we like to bring in some speakers, especially when we have Dr. Scott. Dr. White's going to speak later on in the year for us. I think Lori's going to do a little speaking. So we try to bring in different people just to kind of mix it up a little bit, so you get to see different parts of and learn different things from everyone.
So next month is a behavioral,
Is Brandon leading it next month?
it's the New Hope.
Oh, we do. Okay, if we have back-to-back speakers, I'm sorry. This will actually be neat. We haven't had this before. This is a therapist from New Hope, is that what you said it was? And she specializes kind of with like eating disorders and different psychological things. And so that will actually be, I think, really, really neat to kind of dive into. I think historically disordered eating has been more so like anorexia and bulimia and less of binge eating. And now even insurance companies are starting to recognize that binge eating is really an eating disorder, a true eating disorder. And so I'm excited to kind of see what she has to say too.
And
Learn
that's
some-
next month?
That is next month, yeah. And we'll market that online as well. And then April we will have here, and that will be a regular group. So we try to mix up our speakers, but I think Brina had already arranged that, and then Dr. Scott just said, "Yeah, I'll do next month." And I was like, "Oh, okay, sure." So, okay. If y'all don't have any questions, make sure you're following us on Facebook and Instagram. That's where we'll have this recorded as well. So if you think you want to hear something, if y'all have any questions about this at all, just give us a call. You can ask for myself. You can ask for Emily. I'll be happy to answer any of your questions. Or, like I said, you can let them know that you want to see Lori and discuss this with Lori. Lori's very proficient at this process by now. And those of you that know Lori, you know she's very thorough. So, all right. Thank y'all so much for coming.
Sorry, you came in with your arms loaded.
No, I'm curious.
I'd rather fly.